My name is Megan Reed. I'm a physical therapist and the clinic director of the Recovery Project in Lansing, Michigan.
So tell us what's new here at TRP.
So I recently received my certification. I'm a certified Duchenne Muscular Dystrophy therapist. And when I started pursuing that certification, I was the only certified therapist in Michigan. There are a few others now, but we're far and few between in the area.
Wow. So tell us about what Duchenne is.
Duchenne is a form of aggressive muscular dystrophy. It affects, for the majority, only males. There are rare occurrences in females, but it's a male disease. It affects younger boys. So their initial symptoms can come on anywhere from the first year of life to about 5 years old. They start experiencing difficulty walking, clumsiness, and it progresses from there. So their bodies don't produce dystrophin, which is really important for repairing our muscles in our body. So it continues to break down. Age or life expectancy used to be somewhere in the late teens, early 20s, but with medical advances, happy to report they're living longer and longer as time goes on, well into their 30s in some cases with better medical management.
Okay. So what does that mean for TRP as far as, yes, they're few and far in between, but what does that really mean for TRP? Like, what can we really do with those patients?
I think the goal for TRP is now we can get these patients earlier on and help navigate this process that these families are going through. The diagnosis of Duchenne's can be a rather devastating one initially, and having someone who is well-versed and educated in the management long-term of these individuals can really be helpful for navigating something that is overwhelming and confusing for a lot of people.
Okay. And so tell us, like, what does therapy kind of entail for those particular patients?
So we definitely want, it depends on the stage of the disease that you are starting to treat these individuals. So if we're getting them really early on, generally they're still ambulatory, so they're still walking, and we're working on making sure that they're safe walking. You're teaching them a lot about saving their energy or energy expenditure, making sure they're not overworking their muscles throughout the day. Little 3 to 5 year old boys, they are constantly moving. So educating parents on ways to get them to rest a little bit and save their energy for the things that they really want to participate in is very important. Also, maintaining range of motion through all of our major joints in our body is very important for this disease process throughout the scope of care. So you want to start that early on. Down the road, looking at medical equipment that the family might need and being able to forecast that ahead of time and help navigate that process is very important and beneficial. So when individuals need wheelchairs or any sort of respiratory support or a standing frame or something like that, being able to, not predict the future, but kind of see what's coming and get ahead of the game in those regards will really help them better the care for their son long term.
And so what really prompted the need for TRP to get this certification?
We see quite a bit of muscular dystrophy. There are so many different kinds of muscular dystrophy out there, and the clinic and the company as a whole treats a lot of muscular dystrophy. This is one area that we weren't seeing as frequently because it's earlier onset. So it was just an area that we felt we could benefit from educating ourselves in more. Specifically in this Lansing area, there are very limited resources for families when it comes to rehab. So having someone who's done the extra work to be trained on the latest research and the latest equipment and the best medical management of this disease is very needed in this area.
Great. And so what does that therapy really entail? Not the therapy, but the certification for you. What was that like and what did it entail?
The certification was a course over a weekend that updated us on the latest rehab standards, medical management standards, from like emergency medicine to respiratory, the whole gamut. And then it involves a lot of independent study on the latest research articles that are out and published, so the best standards of care, doing a lot of review of research, and then it involved study and preparation for an examination and passing the test.
Okay. And so what should any parent that has a child that has Duchenne's really look for in care?
Well, first of all, you can find Duchenne Certified Therapists online if you search it. We're certified through the Cure Duchenne Network and the Duchenne Therapy Network. So if you go to either of those websites, we'll be listed there as care providers, and any care provider in your area that's certified will pop up. But they should look for someone who is definitely looking at the patient as a whole. So this disease does not just affect their skeletal muscles moving around. You know, we should be looking at their respiration, their speech, their swallowing, everything, and really being knowledgeable about what's coming down the pipeline, I think, is important for parents to look for in a provider.
Great. Now, another thing, because it sounds like to me this is kind of a rare muscular dystrophy type of disease. So when we talk about that, there are probably not a whole lot of certifications around. And I know a lot of times location for certain people. Why would it be worth a parent to bring their child here?
Because you're getting very specific care, you know, care that is coming from an individual who understands this rare diagnosis that you're dealing with. And time is of the essence. You don't want to waste time. Also, children only have so much tolerance for being in therapy. So if you can shorten your therapy sessions and stay and be more effective, then that's beneficial for everyone. These families are coming in balancing work schedules and doctor's appointments. So if we can be really precise about what we need to do and get them the best care in the fastest way possible, I think that's really beneficial too. That being said, it's really important to have a therapist who understands the disease process, certified or not, because exercise is a fine line with these individuals. You can easily overdo it and make their situation worse or progress them faster than they should. So you really need to work with an individual who understands what is safe and what is not safe for them.
Wow. So is there anything else that we may not have covered with regards to therapy and the illness itself?
I just think right now, with all of the research that's going on, there's a lot of promising medical treatments coming down the pipeline. So I think the need for therapy in these individuals is only going to grow, with potential for recovery and longevity and better quality of life. There's really promising research in genetics and drug development for this disease. So their medical needs and their therapy needs are going to be longer and greater.
Awesome. Thank you so much.